a Stanford and Harvard trained anesthesiologist here live in a real life operating room where I take care of real patients on this table with real medications here in the anesthesia cart. And many of these medications are used for patients, and some of them are used on physicians themselves when they contemplate suicide. And it's a little bit of a tough subject today, but so many of you guys wanted me to talk about it because how many of you have come into the doctor's office with pain, with a sickness, you want your doctor's attention, you want them to help you, and they're just checked out. They're not there. They're either looking at the monitor, maybe they're just listening, but you have to keep repeating your questions because they're not answering. And it's like they're checked out. It's like they're not present with you. It's like they're distracted. Now, what if I told you that 1 in 10 doctors contemplate suicide? Over 50% of doctors know another doctor who has either committed suicide or attempted suicide or has had these ideations. Now, what if I told you that when a doctor has these suicidal ideations, they're more likely to deliver bad care, to make medical errors? This affects you. Not only from you just not getting the care that you need, but they might make a mistake that will hurt you. And what if I told you that a lot of the policies that have allowed this type of environment to affect doctors this way, that individuals who enact those policies in Congress don't actually partake in the medical system as much as we may think? This is a little bit of a case of do as I say, not as I do. And this affects patients in ways that really breaks my heart. And that's why I wanted to come on here. And I was so impressed that so many of you wanted to hear about this. So this is your opportunity for me to share my perspective as a physician, like I said, in a real life setting. And for you to ask questions live, and I'll try to be as real as possible. But I need to give you a little bit of background about why this happens. I shared with you some of the stats and what you need to know to be able to fix this, to ultimately empower yourself to be able to advocate for yourself. Because as you know, you are the best advocate in the medical care system, and nobody cares about your outcome more than you do. Sometimes it may not feel that way, but truly you have more power than you believe. And sometimes if your doctors aren't in the right place mentally, they may not be able to care for you. So why does this happen? Well, I showed you the medications in the cart, and it's not a coincidence that anesthesiologists, psychiatrists, surgeons all have very high rates of substance abuse, in addition to high rates of suicide, which are, by the way, higher than the average population. This might break your heart as much as it breaks mine. Men appear to be about 40% more likely to commit suicide, male physicians. Female physicians, over 200% more likely than average females in society to commit suicide. And those drugs that I showed you behind me there are often easy ways to get there. The opioids that you've seen me show you before, fentanyls, sufentanyls, morphines, etc. Psychiatrists tend to abuse benzodiazepines. We also use them in anesthesia as well. It's not the most commonly one abused by anesthesiologists though. Surgeons are more likely to use tobacco and alcohol, but there is a tremendous amount of humility that us doctors need to appreciate from these real life facts in anecdotal stories. I do know 2 healthcare providers, 1 physician that went down this road, and it's very real. Now, I want to answer your questions. I have to give you a couple more stats here, and what you need to know specifically. Actually, the stats I already gave you. Let me tell you the real stories, what happens. Imagine that you have a balancing beam. There's resilience and flexibility, and there's rigidity. When you're a doctor, you have to go through, obviously, university in the United States, and medical school, internship, residency, fellowship. And I spent over 10 years after college doing this. And it really beats into you a concept of rigidity. And I know doctors aren't the only ones, because when I treat patients for ketamine, cognitive rigidity underlies so many of my patients' complications, whether it's the inwardly focused rumination and perseveration of depression, bits of the past, or the inwardly focused rumination and perseveration stuck in these rigid cycles, of the future, in which case we call it anxiety. And this cognitive rigidity stems in medical school for doctors. It's not just patients. Doctors, we have a lot of black and white thinking, the right answer or the wrong answer. Wrong, you're right. What is a diagnosis? Either you got it or you missed it. There is a lot of imposter syndrome that goes along with this because, and this is important for patients just as much as for doctors, imposter syndrome is often fueled by an intolerance for ambiguity. So when doctors graduate residency and fellowship, when I actually started practicing, it was so different than what I learned at Stanford and Harvard because the real life is dirty. It's not always ideal. It's not a perfect world. There's an ambiguity it's an imperfect world. Pharmaceutical companies are making it hard for patients, and insurance companies are making it hard for patients. This world that we live in is far from the textbook that I grew up with at Stanford and Harvard. And if I didn't have some flexibility to flow back on, to be resilient, to have grit, well, gosh, I would feel very much an imposter syndrome. Like I said, intolerance and ambiguity, intolerance of uncertainty are hallmarks of imposter syndrome, as are, of course, lack of confidence. And you guys know that the confidence, certainty, and curiosity that we talk about so often, are these 3 or 4 C's that I talk about, are so fundamental to our well-being, mental and physical, but it shows in physician suicide when we don't have that tolerance for uncertainty or ambiguity because we're always in a rigid mindset. Well, what happens when, let me give you an example. A patient comes in, and Alexis, thank you so much. That's very kind of you. Thank you, Alexis. Oh, and I see Miriam is also commiserating with imposter syndrome. When a patient comes to us and the diagnosis is clear, it's a heart attack, well, we can treat that. It's a pneumothorax. We can drain that. Whatever it is. When we have patients that come in, we don't know what's going on. It's very hard for patients when we have patients that we don't know what's wrong with them. There's an uncertainty. Let's say someone's in the operating room with me, right? They're on the table here. We have all the monitors connected to them here. And their oxygen goes down, and I can't explain why. That's incredibly anxiety-provoking. If I can't figure out why, it's not a pneumothorax, it's not an MI, not a myocardial infarction, it's not because of overdose of anesthesia, it's not because of a surgical complication. These are uncertainties that physicians have to learn to deal with, and they can be life or death sometimes. It's very difficult for us, and it's not a sob story, it's a reality that many non-physicians have to deal with as well. But physicians aren't always ready to ask for help. And this is the second thing. We're not trained. We're trained to give help. We're not trained to ask for help, which, by the way, my patients are often, I always applaud them when they come to ketamine for me. Because I'm like, thank you for thinking outside the box, being empowered to take care of yourself and being proactive. Because your tenacity is such a powerful predictor for your success. Advocating for yourself and asking for help, which doctors don't do. Once again, do as I say, not as I do. This hypocrisy is so deep-rooted in medicine, it breaks my heart, and it breaks physicians, and that's why the suicide rate's 40% and over 200%. Ambiguity, if we can't tolerate it, if we're so rigid, like we said before, the willow reed can wave in the storm. Or if you're from Florida or the Caribbean, the palm tree can wave in the storm. The mighty oak tree snaps. And that's what and when it reaches that breaking point, physicians can be led to substance abuse, like I showed you, and then suicide. Now, there's also the silence and isolation. Doctors are so afraid to speak up about this. And that's why I'm here telling you, because how many is too much? Enough is enough. And there is no reason for us to be so arrogant to not pretend like we need help. If we're trying to be a role model for patients, don't we need to be a role model for patients? Don't we need to do the right thing, right? There's this pressure cooker, obviously, that, a pressure cooker is a rigid container, right? It's why you can crank up the heat, let the water evaporate, vaporize, and it builds pressure in a rigid container. That rigid container is like our mindsets as well. The pressure cooker of working in a hospital, I'm going to share something with you that is, forgive me for being so brutally honest, but this is the reality of the imperfect world that doctors operate in. When we're in the operating room here, in most places, we have nearly like quota-like expectations to get patients in fast enough. They're timing us on how fast. We're putting people to sleep, waking them up. You hear me talking on this channel about calling patients the night before. And Jody, I am totally okay. Thank you for your concern. I'm totally okay. I'm sharing with you what I'm not okay with, which is the system that lets this happen. But Jody, I am okay. Thank you. Thank you. You know, on this channel, I want to talk to patients. I want to give them the care and love and compassion they deserve. I mean, you're surrendering your body, your mind, your consciousness to us. And when there's quotas against how fast we're working, how many cases we're crunching a day, when my friends, colleagues who are primary care doctors, you know, they get called in to offices of executives reviewing how many patients they're seeing a week, a month, a quarter. And if they're not seeing enough, they get a slap on the wrist. Maybe you guys know these stories, but these are the realities of medicine. And this is a pressure cooker that does not help patients and does not help physicians. So it's not all a sob story. There's, of course, ways that I'm going to share that you can get over this. But we need to know the reality. We need to know the reality of what doctors are facing, because you are at risk. You're in the crosshair if your doctor is not present, is not mindful, not conscientious, isn't giving you the care and attention that you deserve. Right? You patients are the ones. So, how do you fix this problem? Well, luckily, we know a lot about suicide. There's a lot that we don't know about suicide. One thing that we know is that it's multifactorial. It's not one answer for why physicians have these way higher rates of suicide, especially given the years of education that go into them. Many reasons, but some of the common ones that patients share as much as doctors. Hey, I'm leveling with you, everyone. I know better than you. I'm not going to pretend to have, maybe I have different coping mechanisms that I hope are very powerful, but you have access to those coping mechanisms as well. I am no different than you. We all face similar adversities in life. But doctors sometimes are too arrogant, like I said, to ask for help. We're sometimes afraid to say that we don't know the purpose and meaning of what we're doing. This can break a physician, but it also is a spot of intervention. A physician goes through med school for all these decades, like I said, to come out not knowing how to treat patients, not working in an environment where they feel they can help patients, it's shattering to their identity, to their ego to an extent. And this can contribute, of course, to loss of purpose, direction. Once again, loss of meaning of life, we know can increase the risk of suicide, and having a sense of meaning in our lives can help protect against suicide. So when doctors lose that, we're at risk just as much as our patients are. And that's why, you know, when I'm having someone come in for a psychedelic experience, even before surgery, if it's not a ketamine clinic, what are we focusing on? We're focusing on our values and being honest. Anyway, we can go on, we've seen other videos, we don't have to go into the specifics, but it's about breaking the ego and the identity that's often so, I guess the shattering of that ego, I should say, contributes so much to this mental pain that so many doctors and patients have. But let me tell you something else, because this is something that really makes me hurt. And this is the office of the attending physician. Who, and I don't get to pause, I'm going to pause. Who here knows about the office of the attending physician? And now I'm going to take a minute to look at what you guys, there's a lot of fantastic comments coming in here. But who here knows about the office of the attending physician? Because this is what we don't talk about enough. It's what leads to a two-tiered system. Who here, and I'm going to give you a shout out if you tell me, who here knows about the office of the attending physician? Hey, Jody, thank you for the kind comments, by the way, I appreciate it. And what a two-tiered medical system refers to. And why physician suicide is probably more present in one than the other of those two tiers. And who are the people receiving care? This is what we don't talk about. Because I'm telling you, the system is very broken. Patients are not meat bags. They're not water bags. They have emotions, they have feelings, they have histories that deserve care and attention in a system that's unforgiving to give that to them. Patients suffer and physicians suffer. But what is this two-tier system, and what is the office of the attending physician? What is in the United States, that is. It's not the same in other countries. I am Devil Woman. Thank you for the kind comments. I appreciate that. And Summer, I also hope that you can find access to a ketamine infusion clinic. Linda, thank you as well for the kind comments. Alexis, as always, thank you. Michelle, it's good to see you on here. I'm sorry about your story about the suicide. That's really speaks to what we're talking about today. How much did suicide by doctors change during COVID? Sweet and salty. This existed long before COVID. Long before COVID. All right, so Chris, aka Healthy Healings. It's a congressional, okay, Chris got it. The Office of the Attending Physician is a special office that I personally don't know any physicians in. It's very hard to find any information online, except for one Snopes article I found from a little over 10 years ago. I'll be honest about the source. I don't know any docs in here, but that Snopes article revealed something that's very important for us to know. There's a different type of care available to decision makers for our care. The decision makers that are determining the care that you get and the care that I as a doctor can deliver to you. That clinic does not have the same quotas from what it appears. Now, once again, full disclosure, I don't work in this clinic, but gosh, I'm reading what ex-doctors have said and what members of Congress have commented on regarding it, and there's very, very little. But do note that this is the beginnings of a two-tiered system when decision makers have access, and I'll share something else with you. There are VIP patients in medicine, and when I get called to a patient who is a VIP, I won't name any names, but that VIP care is very different. Not from what I like to do. I like to treat everyone the same, but the system allows more time for the VIP. Allows for more time of them asking me questions by the VIP. This is a two-tiered system. And this is available to maybe 0.5%, 0.01% of the population. And it's not by accident, perhaps, that the decision makers are the ones that have access to that extra time with me in those cases. Now, realistically, I do very, very few VIP patients. You know, these are athletes, politicians, et cetera, because I spend most of my time. And I'm not saying I'm not Mother Teresa here or anything, but realistically, I just don't. There's more non-privileged than privileged, right? But it does impact the healthcare that we all get when we are in a pressure cooker and you, the patient, get the doctor that's burned out, more likely to commit a medical error. Do think about that. And I hope that you feel empowered to speak up for yourself and to support your doctors and the nurse practitioners, whoever, who are delivering the care to you, the primary producer. Do feel empowered to make sure that you are getting the best care you can get from those doctors. And be cognizant that perhaps the decision makers are getting a different level of care, even though they advocate something different for you. That really bothers me as a doctor. I'll end by saying that lip service is not good enough. And I want you to be empowered with the knowledge that you learned from me and from others. Share what you learned with others. Of course, I always appreciate it, by the way, if you can leave a like or a comment to support me doing this more often, because I believe that giving you knowledge empowers you, the patient. And the more knowledge you have is better than any lip service that any managed care or whatever hospital system is giving their doctors, that, oh, we support doctors doing the best for patients. We support this and that. That lip service means nothing to me if the patients aren't getting the care that they deserve, which all too often happens, because I see patients that come into the operating room mortified about what's going to happen to them, or patients that come to my ketamine infusion clinic, having come from those broken systems and not having gotten the care that they deserve. And it stems oftentimes from a lack of confidence in patients to advocate for themselves. So please keep learning. If you want to be a good patient for your doctor, advocate for yourself. Take responsibility for your health. And physicians out there, please take responsibility for your health. If you want to be a role model for your patients, you have to be a role model, and it starts by taking care of yourself. Self-responsibility for your health. How many physicians, like I said, higher rates of addiction, higher rates of suicide. How many overweight smoking doctors have you seen in your lifetime? That's all one too many.